Good afternoon. Hello, I'm Dennis Galucki. Welcome to our 604th Imagine Greater Buffalo program and our fourth YouTube production created by the Center for the Study of Art, Architecture, History, and Nature and hosted by ImagineLifelongLearning.com. This is all done in partnership with the Erie County Historical Commission. This YouTube series is focusing on how Erie County and New York State are commemorating USA 250. Today's speakers are Randall Hoak, Commissioner of Erie County Department of Aging, and Katie Earl, the Project Administrator for Recreation and Wellness within that department. So let's begin. Randy, you're serving within a context of a national act that creates this awareness of aging at a national level and certainly at a state level. Tell us more.
Absolutely. Well, first, Dennis, thanks for having us on. This is, we have some important programs and services for sure, and we'll talk about those today. But I really appreciate the historical lens when discussing services for older adults. And if you think of senior citizens, if you think of aging in the context of our nation's history, so much has changed. I have worked for 30 years with senior citizens. And when I started my career, I didn't know I was starting a career at the age of 17, but I was working with seniors at the age of 17. And the folks that I got to know, the stories that I was able to hear were stories of what a childhood may have looked like in the very late 1800s. So think about as a 17-year-old in 1996, listening to a woman tell you that she was responsible to watch her younger siblings every day while her parents worked in the farm at the age of 5 years old. That was the primary caregiver for the family while the parents were working. And I say that because at the time, in the early 1900s, there was no real concept of adolescence. Children were children until they started working in their early teens, and then they were adults, and they had full expectations of adults. And that's important because since that time, there are many more stages of life than just childhood and adulthood. Childhood, adolescence, and adulthood. A child born today in the United States has a 50% chance of living to the age of 104. So if we think of our experiences growing up and our grandparents who may have, worked until 60, 62, 65, 67, and had a few years to move down in Florida and enjoy life, things are different now. So if you are able to retire at 65, you have 30 to 40 years to continue to contribute to our society. Perhaps continue in full-time or part-time work. And certainly one of the opportunities that we promote here at the Department for the Aging is volunteer service. So thinking of the programs that we offer and the history of our department in that historical context, it's interesting. And our seniors have some wonderful stories to share. Our department is organized and really came to be as a result of the Older Americans Act of 1965, which I would argue was the very first time that the federal government recognized that there's a need for community support for older adults. Certainly before then, there was the need for institutional support, long-term care facilities, nursing homes, retirement homes, and what have you. But that Older Americans Act recognized that it's important to provide social opportunities for older adults. And the Older Americans Act has evolved significantly since that time. But that was the basis. That's what got our start. We operate under the authority of the Older Americans Act. And in New York State, each county has what's called an area agency on aging. And that's what the Department for the Aging is. And there's a number of programs that we bring to the community. And there's some very important responsibilities that we have as an area agency on aging.
Good, good. Katie, what's your role in all of this?
So I'm fortunate enough to oversee all of those recreation and wellness programs for our department. I support a team that runs the volunteer program, free exercise classes, educational opportunities, evidence-based programs for falls prevention. So a lot of opportunities for people to engage, give back, stay connected to their communities, and just age with dignity and grace. So just really excited about everything we have to offer and with all of our community partners.
Can you both get more specific? What types of programs are available? As you mentioned, there's a wider spring of aging and post-retirement. There's young retirees, and there's middle-aged retirees, and there's older retirees. How do you cater to those in three different ways?
Absolutely. So I'd like to return to a bit of historical context before I go deeper into the programs and services that we offer. I mentioned the Older Americans Act of 1965. That really set the framework for area agencies on aging. But the next most influential piece of legislation in the United States that has impacted area agencies on aging, believe it or not, is the Affordable Care Act. Early in my career, I recognized, and many professionals in the field had recognized, that it makes a heck of a lot more sense to support older adults in their homes, in their communities, keep them active and engaged, rather than waiting until they needed much more expensive institutional care. Medicaid is under a lot of strain and has been for some time because of the cost of long-term care. The Affordable Care Act was a major step forward for the United States in allowing those community-based services and supports to be paid for with Medicaid dollars, saving taxpayers money down the road. For every day that we can keep somebody in their home where, let's face it, they would rather be, saves money and strain on the Medicaid system. So I think that's important to note as context for the services that we offer. So I'd like to give a brief overview of some of those programs and services. We have several units within the Department for the Aging, and those include what we have here: case management, information and referral, nutrition, wellness, transportation. We have a fiscal unit that helps us to count all the beans, and of course, program development and evaluation to make sure that our programs are effective and being delivered in the right way and in the right communities. That's a general overview of our department, but I'd like to go into a little bit more detail for those programs and units. Case management, this is where we will send somebody out into the community for an older adult that has identified some needs that they're not able to meet within their own social or family context. And we provide a number of services. Again, the goal is to keep this person in their home, active, engaged, and involved in the community. They may need a little bit of help to do that. That might mean that they may need a home care aide to come into their house to help with what we call their activities of daily living. That could be something very simple, like bathing, dressing. It could be light housekeeping. But when folks need a little bit more help, again, it makes a lot more sense to bring that help into the home so that we can keep them in the home. There's a number of programs in New York State that can help older adults homeowners, utility rate payers. And when our case manager works with a person and families, we make sure we go through the list of programs and services that they're eligible for. The process really starts with New York Connects. This is a number that each county has. In fact, there's an 800 number that folks can call to get connected to us, but there's also the local number, as noted here, 858-8526. When people call this number, they're connected with a trained case manager that lives here in Erie County, that has been trained here and has a great deal of expertise. New York Connect staff are tasked with the mission of delivering person-centered care for older adults. That means that you, the older adult, you're driving the bus. If you call us and you'd like a visit, we're going to visit you where you are, where you would like us to visit. Absolutely, you can come downtown and see us if you like. Parking can be a bit of a challenge downtown. So if you'd rather us come to your home, we'll come to your home. If you don't want us to come to your home, the way my house is today, I wouldn't want anybody coming. My wife's been out of town. She's going to be back tomorrow, and I got a lot of work to do tonight. But if you want to meet us at Tim Hortons, we'll meet you at Tim Hortons or a community center. Again, the focus is letting that older adult drive the bus in developing and managing their care plan. Health insurance is a major issue for our older adults. Medicare can be extremely complicated, especially for folks that are choosing between the very many Medicare Advantage plans. There's a difference between the traditional Medicare and Medicare Advantage plans. And in Erie County, Medicare Advantage makes up over 70% of the market share. There's many different plans that cover things in a different way. We offer health insurance assistance and counseling for folks that are trying to figure out what's the best plan for them. This is a program that lives right here in our department. And the major offering for this program is non-biased information. You can sit down with those Advantage plans, but very likely that's going to be much more of a sales pitch than an evaluation of what is available to you. So we have a team that will meet with you, that will talk through these issues on the phone. They'll help you take a look at what medications what prescriptions you have, what specialists that you see, and help you make the best informed decision for your Medicare Advantage needs. There's a number here. You can certainly reach that through the 858-8526 numbers, but if you want to cut right to the chase and call Bill Daniels, who's been an employee of this department for 42 years and is very skilled and very knowledgeable when it comes to health insurance for our older adults. Caregiver services. Again, this is an area that, people didn't really think of going back several decades, what a caregiver is. But now more and more people are realizing that if they're not a caregiver now, they will be a caregiver at some time, or perhaps they're going to need a caregiver at some time. So we have a unit specifically dedicated to help caregivers navigate the systems, engage in self-care, and find respite opportunities. And there's a number of ways that we do that. Some of them are mentioned here. We have caregiver counseling, safety devices that will help the caregiver care for their loved one. Caregivers often just need a break, and we're able to find some programs or services to help them get that break, because caregivers need to take care of themselves. And I've worked in this field long enough with enough families to know that it is not unusual when you have a caregiver caring for somebody that their time will come before the person that they're caring for because of the stress involved in caregiving. So we want to reach those caregivers early on to know that there's help available and we're here to support them. Social adult day programs are a great resource. In fact, that's where I began my career. And these are programs where folks go during the day. The caregiver can drop them off, and there's meals, activities, field trips, and the caregiver can, a lot of those caregivers, they're still working. So they use that time to go to work. If they're retired, they'll use that time to go to their own doctor's appointments or to participate in their own social engagements as well. So we have a lot of support. Caregivers are so busy that it's often hard to get their attention. But the caregivers that are supported provide better care, lead healthier and longer lives. And we're here to help folks in that situation. Our nutrition programs are probably our most visible programs. A lot of folks will be familiar with the senior lunch programs that will likely take place at the senior center in their neighborhood. What I think is very interesting about these programs, we have 1 million people in Erie County. We have 240,000 older adults, and in our nutrition programs, we serve a few thousand. And you might ask, why aren't more people coming to these programs? Well, I can tell you a story that a lot of people might be able to relate to when it comes to the senior center. I know with my own grandparents, and we hear it in the community all the time, they don't want to go to these programs because it's just a bunch of old people. Now, these old people are younger than the people that are making that statement. But I share that, and it's an interesting story, but that's really a big part of our work. You know, the activities that take place at the senior centers that we work with in Erie County, they are not your grandparents' senior centers. These are folks that are engaged in some very interesting social and recreational programs. One of those programs is our University Express program, and Katie runs that. We have a great season coming up this spring. But Katie, would you like to talk a little bit about University Express?
Absolutely. We have a fantastic team of 3 that run that program. So our classes will be starting in May. We have around 175 topics located at around 30 locations in the county. So that's about 350 sessions. So there's something for everybody. And when we're talking about the historical context, that's the most requested category that the team gets. So we have classes on the history of Buffalo architecture. We're coming up on the 125th anniversary of the Pan Am Expo, so we have a class on that. We have a class on pickleball. We have class on holistic health. So really something for everybody. And my team really works collaboratively with all of the other departments in the county. We have collaborations with the Parks Department, like we're going to be at the Shank House that just recently went under a lot of renovations. So a lot of really wonderful, wonderful things. And they're kind of a gateway to get people into those senior centers. As the commissioner said, some people are kind of hesitant. They don't know anybody. They don't know if they'll belong. They're not that old. These programs for rec and wellness get people in so then they can see everything else that's going on, meet some friendly faces, and then feel more comfortable to go back. I went to a Club 99 exercise class. I met this person. I'm definitely going next week. So it's just a lot of opportunity for good things.
So while we're talking about University Express, I do have to put in a plug. I will be teaching my very first University Express class this spring on June 5th at the Orchard Park Senior Center, which also has a bit of a tie-in to history. And I'm going to be co-presenting this class with somebody who's very important to me, my mother. And my mother has a inspiring story herself. And this is a woman who grew up in the foster care system locally, and later on in life was able to meet her biological parents and research their experience. These folks are from the Oneida Nation, my grandparents, and my grandmother, Hazel Brown, is a survivor of the Mount Elgin Industrial School outside of London, Ontario. So we're going to be talking about generational trauma. We're going to be talking about the residential schools that existed, and we're going to be talking about how that has impacted and shaped our family as well. June 5th, Orchard Park Senior Center at 10 a.m. You got to register for these classes, so please don't just show up. But you can register at the Orchard Park Senior Center by calling 716-662-6452. So enough of the plug. There's a few more programs that I just want to share. Well, first, some pictures. So Katie shared some pictures with me just to kind of show how much of a good time we have. These pictures are some of the cooking demonstrations, healthy cooking demonstrations that we do at the senior centers. Our annual summer picnic that we have, where we have 2 days where seniors from all across Erie County come to a county park, enjoy nature, enjoy some Chevettis chicken, some good music, some card playing, some dancing, and of course, some ice cream. So we talked a little bit about our recreation and wellness programs. Katie mentioned Club 99. It's an exercise and physical fitness program that was really started by a longtime senior services employee, and at one time a bit of a local celebrity, Richard Durwald, Mr. Fitness, who was a local wrestler back in the 50s and 60s. And he is still works with the department now, and is really in better shape than most of the folks that I know that are half of his age or less. We talked about University Express, great program. We have volunteer opportunities for folks that are looking for something to do, for folks that are looking to bring their skills, their experience, and their stories to the community. We have what's called evidence-based programs that promote health and wellness that we deliver at the senior centers. And by evidence-based, we mean that they've been proven to be effective. Fall prevention efforts, gardening club, and so forth. Again, we have some great pictures, some of the field trips that University Express leads, as well as our Club 99 program. And yeah, you see a lot of smiles in those pictures. Transportation is a big issue. People need to get to where they need to go for many reasons. And we help folks through our Going Places transportation system. The phone number is there for folks that may need transportation to medical appointments, to grocery shopping, trips to the senior center. It's honestly, there's more need than there are resources available. But the department has been the recipient of some significant grant funding in the past 5 to 7 years to build and expand on our transportation offerings and work much more closely with our metropolitan planning organization, the city of Buffalo, the local towns and villages, as well as our community-based organizations in the community to bring more transportation opportunities to older adults. That's our number. We say it all the time. It's a number that it's like your childhood phone number. You know, I remember the phone number at my house growing up. I will always remember 858-8526. That's really the place to start. And any of the programs that we've mentioned can be accessed through that telephone number. And I think, yeah, that's all the presentations, the nuts and bolts. But certainly would be happy to answer any questions or continue the discussion further, Dennis.
Let's do that. Randy, Katie, great overviews. I was thinking as you spoke, you make a very good point. Most of us don't want to think about aging until we're need to think about aging. And sometimes it's an illness, sometimes it's something incapacitates the other relative to a couple, husband and wife, even and especially death. They're on their own. It seems to me like you're providing the potential community that could support people at that most critical time, that new reality in people's lives. Could you speak to that? Is that where you sense people are especially open to finding out what's in the community to help, or do they not even imagine that there is something out in the community?
Yeah, that's the challenge for us. Now, I will say that most people don't want to think about aging. I love thinking about aging as it relates to me.
That's
I
good.
am really looking forward. I'm certainly enjoying the stage in life that I'm at right now, but I'm excited about the opportunities that will come with the wisdom that comes with aging, with the resources that comes with aging. If you look at our older adult population, that's where a lot of the wealth resides, the home equity. These folks have some significant financial resources and are a major contributors to our local economy. What people don't like to talk about, which is exactly what you mentioned, Dennis, is chronic disease, disability, the loss of independence, losing the car keys, not being able to drive. That's what people don't want to think about. And that's why we're here, to help folks meet those needs, to remain active in their communities, which you can do. In some neighborhoods, it's harder to stay active and engaged without being able to drive. I know I live in Hamburg, New York, and in many of the communities in Hamburg, if you don't have a car, if you're not able to drive, you are really isolated. And perhaps a conversation for another show, but I really attribute that to the way that communities have been built in the 60s, 70s, and 80s. They're not built for people to walk to the corner store. They're cul-de-sacs, which have, served their purpose, but they are not built for social interaction. They're not built around third places, recreational opportunities for people to connect to, not just with other older adults, but across generations. So, that's one of those challenges that many people in Erie County have. If you think about some of the older neighborhoods, you have people that can sit out on their front porch, talk to their neighbors, talk to the school children who are walking by on their way home from school. There's a lot more interaction. And I have to add that when it comes to that interaction, the opposite, social isolation, has a very serious health impact on anybody, but especially our older adults. There's research that shows that being socially isolated is the equivalent of smoking 15 cigarettes a day. It's significant. So we have challenges to meet in all these different communities on how we can keep people connected. Many of our older adults, they don't need our help with that. And we're here for them when they need us. But there's a lot of folks, because of the way their community was built or because of some of those chronic conditions, disability, and losing independence, they may need a little bit of extra help and support.
Mm-hmm.
Randy, and then I want to ease into Katie here for a quick follow-up. On the education side, so much of what you're describing, wellness, lifelong learning, these are terms that are just now creeping into the vocabulary of society. You didn't hear that. I was a good friend of a fellow Phil Haberstroh that was over at City's Wellness Institute, and I said, this is a great term. It's encompassing. it talks about how we're living today so that we can age perhaps better, life willing. So it's important. So that, Katie, gets me to your side of it. Since this is imaginelifelonglearning.com that's putting these YouTubes together, in my belief that it's lifelong learning that is essential. None of this, all right, I graduated from college, oh, I've got a PhD, I've got a master. No, it's lifelong learning, especially as the pace of change accelerates. There's no stopping point. And certainly when it comes to matters like satisfaction, hanging out with others who are asking questions and trying to learn more, that seems to me a formula for success from your standpoint, both of your standpoints. Elaborate a little bit on those programs. Katie, how long, how are they filled? And in a Zoom era, are they all physical, or is there some digital technology being used?
Yes. Well, so University Express, we say it kind of came into being around 2012 and has been changing and growing ever since. And so, speaking to the virtual aspect, in 2020, we took that online just like everybody else did. And the thought was, not many older people are online. What are you doing? And then we saw a great response for people joining our virtual classes. And thankfully, we were able to use a portion of our American Rescue Plan funds to outfit around 33 senior centers that we partner with Cisco technology. We use WebEx, very similar to Zoom, but not the same thing.
Mm-hmm.
So they can interact with each other and then interact with people at home. So my University Express team stream around 40 classes each semester. Wow. So folks at home can join, they can engage, there's the chat, they can ask their questions. Other centers that don't have the program but are still looking for content can join. And then similar, Dennis, to your library, not quite as impressive, but the University Express website has around 225 recordings that folks can join on and watch when there's nothing good on TV. So when we're speaking about that lifelong learning, we have people that want to learn about the Syrian civil war because they're very interested in that. And then maybe they find people in that class, they go to have lunch at the center after, and they continue those discussions. Or maybe we have somebody that's like, you know what? I've worked really hard and now I want to get into crafting. So we have a bracelet making class and beading, or we have watercolor classes. And then those people that do our classes, they think, hey, I want to give back. Then they start volunteering with us because they want to introduce our speakers. They want to teach. They learned about Make-A-Wish and now they want to volunteer. So it's really full circle and so collaborative within our department, all of our programs winding into each other. And something for University Express that we gained a lot of feedback for was field trips. People wanted to be able to go somewhere, but didn't have maybe a friend to go with or couldn't afford to go to that museum. But because of the partnerships we have in the county, we can take people to the Birchfield Penny, and we can take people to the Will North Planetarium. And somebody knows that there will be other people that they can meet and then further carry on those conversations. So it's been a really wonderful thing to see grow and bring people together.
That's exciting, Katie.
Mm-hmm.
Our time was about the same. I started the lecture program, the Imagine Greater Buffalo lecture program, in December of 2009. And then suddenly in 2020, COVID hit. And the library by September said, let's try this new format, this Zoom format. So we too have about 220 YouTube programs. I think there's a potential merger here of sorts, which we'll discuss in the coming days. How is that? This is lifelong learning. You're about lifelong learning. And then that reinforces the whole age issues, all the issues that your department then covers. I think this can be the beginning of a beautiful friendship. How is that, to take an old Casablanca line?
So, Dennis, if I may, you mentioned Bill Haberstroh, And Phil was certainly a visionary, perhaps a little ahead of his time, and an early influence on my career. But given the context that you laid out, lifelong learning, and the conversation that we've had today, talking about this additional phase of life that we haven't had in our society up until now, I'd just like to share a statistic that to me is really quite shocking. 2/3 of the people in the history of the world that have lived past the age of 65 are alive today.
Wow. And that covers the current world or history?
In the history of the
The
world.
history of the world. Wow.
Yes, are alive today. So, yeah, these are things that we haven't issues. We are really at the cutting edge of older adult services. Our society has not had to respond to not just the needs, but the opportunities that come with a much older population. People are living longer. And if you think about the medical field, go back 50 years. If there was let's say, a woman in need of a hip replacement at the age of 75, it would probably be a different decision than today, when that same woman can get a hip replacement at 75 and enjoy 20 more years on the golf course. So there's opportunities that we're responding to in a different way. And that's going to have a ripple effect through the medical community, through senior services programming, through how we spend our money, social opportunity, and so forth.
Very much so. All right, we're going to wrap this up. I'd like to say to be continued, because that's what Imagine Lifelong Learning is about. We have to imagine it. And I think it is a new generation of thought, and we just happen to be alive during that time, both of you. So we're all at different stages. So let's continue this process. All right. Thank you, folks, for watching today. I will remind folks that over 200 Imagine Greater Buffalo YouTube programs are archived on the Buffalo and Erie County Public Library YouTube channel. Also, over 1,500 audio podcasts from Buffalo and Chautauqua Institution. We've tried to connect these two dots, created by the Center for the Study of Art, Architecture, History, and Nature. Those are available at Internet Archive. Just go into their search at Internet Archive and put in the acronym for the center, C-SAAHN, which I pronounce C-SAAHN. So you can remember it easier. I'm Dennis Galucki. Be well and good day.